Hi, good morning. I'm going to do a cuff management and oral care with a patient. So the first thing I'm going to do is check the patient's chart, and then when I'm ready, then I can gather all the necessary equipment, any necessary information that I may need when going into the patient's room. So I will knock on the door, introduce myself, and then I'm always going to check the patient's ID band for their name and date of birth and make sure I have the correct patient. And then before I always do a cuff care, anything like that with a patient, I always want to do an oral care with them. But before I begin any of that, I always want to make sure I have appropriate PPE on, and I'm going to check the patient. So I'm going to listen to the patient's lung sounds, and I'm going to listen to their cuff, where that's at, see if I hear anything, any gurgling, if there's a leak, if it got loosened, anything like that. Then I'm also going to notify what size of endotracheal tube that the patient has, and also the placement of where it is placed in the patient. So when I'm ready, I'm always going to do my oral care first. So I'm going to get my suction ready to go. So I'm going to hook this up to my suction, and I'm also going to have an extra tubing and hook it up to my anchor. And then I'm going to set it to the -100, the -120 for the patient. So always before I do the oral care, I'm going to suction them out. So I'm going to put the protective sheath down, and I'm going to turn on the suction. I'm going to suction the side of the cheeks, the back of the mouth without initiating that gag reflex. And then I'm going to shut this off, make sure it's off, and then I'm going to go ahead and get their oral care ready. So you want to do oral care with a patient with endotracheal tube, anything like that, every 2 hours. So what I'm going to do is take and put this in a protective area, attach your oral care, and so you don't have to have the suction on right away. So you're going to dip it into your oral agent, and you're going to do the side of the cheeks and around the gums and back of the tongue and everything. And then this one you can suction out with this one and get any of that excess stuff. And you're going to dispose of that. And then you're going to put your yanker back on, and then you're also going to do your moisturizer. So you're going to make sure everything's moisturized, like your lips, everything is nice and moisturized. So that way, because of the oxygen in their mouth can get quite dry. So if you see any excess stuff that needs suction, always suction that out. So that way when you do your cuff care, they don't aspirate anything. So when you're ready, so you're going to get your piece ready. So you're going to do your minimal leak technique here. And so you're going to connect your syringe to one side, and then you're going to have a meter with the tubing, and you're going to connect it there. And then you're going to connect your other to your cuff. And this will be your little deal there. So you're going to connect it there. And when you're ready, so what you're going to do is always listening to the side of the throat. So like you're going to listen right here with your stethoscope, so that way you can hear that first initiation of that first leak. So what you're going to do is you're going to take your syringe, and you're going to slowly remove it. And you're also going to listen, and once you start hearing that first initiation of that leaking sound, you're going to look at your meter and chart down where it was at when you first heard that leak. And then the next thing that you're going to do is your evasive technique. So that one, you're going to go ahead and start putting pressure into that patient's cuff until you hear that occluding point. So you're going to try when you start hearing that occluding point. And then when you're done with doing your technique, your minimal leak technique and everything, so what you're going to do is you're going to take another meter, and so you're going to connect it to here, and you're going to make sure that it is at the appropriate area. So you want the 20 to 30. So what you're going to do, if it's too low, then you're going to increase that cuff pressure. And if it's too high, then you're going to go ahead and use this little red button here, and it's going to release that pressure. So that way you know you have the appropriate pressure. And always, after you're done doing anything like that, you always want to listen to make sure you don't hear any leaking sounds, and make sure always that it's not too tight, so that way you don't get any sores inside the patient or any irritation. So when you're all done, make sure everything is disposed of that needs to be disposed of. You're going to go ahead and reassess the patient, listen to the patient's lung sounds, check the vital signs, make sure everything's still okay, and always check to make sure the settings on your machine are at the right settings for that patient, and then chart everything in the patient's chart.